Hi, in this video I'm going to talk about antenatal hand expression, what it is, why you might want to do it during pregnancy, how to do it, and then what to do next. You might hear antenatal hand expression being called colostrum harvesting, so it might be useful to just start with finding out a little bit about what colostrum is. So sometimes without even any outward signs, without you realising it, your breasts are busy preparing to feed your baby. From about 12 weeks, they start producing some milk, and then by the second trimester, there should be colostrum present. Colostrum is amazing, and you'll often hear it being called liquid gold because that's how valuable it is. Colostrum is designed to be your baby's first feed, so it is packed full of proteins, sugars, fats, and all the nutrition that they need. It also contains oodles and oodles of protective factors and immune factors that will protect them through those early weeks. So it really, really is amazing. You might hear it being called baby's first immunisation. It's that powerful. Colostrum can be thick or thin and is often a yellowish colour, which comes from the beta carotene, which is another protective factor within it. So it's really good stuff. Why hand express during pregnancy? There are loads of reasons why you might want to express and store your colostrum antenatally. You might have been advised to do so by your midwife or another healthcare professional. You might want to think about hand expressing and storing colostrum if you have gestational diabetes, if you're very overweight, if you're having a planned C-section or induced labour. All of these things can delay full milk production, and so your stored colostrum could be just the best supplement that could be given to your baby during that time. You might want to choose to hand express if you're expecting multiples, or if you know that they've got a congenital condition. So yeah, lots and lots of reasons. Or you might just simply want to get to know your breasts, which is a really, really good idea, and just start to get familiar with the process of hand expression, which is just going to be a really useful skill for you to have as you go on and feed your baby. I just want to reassure you that antenatal hand expression from around 36 to 37 weeks is safe. There are some instances, though, where it's not advised to hand express during pregnancy. So if you've had any antenatal bleeding, if you've got a low-lying placenta, if you've got cervical stitches, or perhaps a very small baby, then you wouldn't want to be hand expressing unless you've been particularly told to do so. If you're unsure, just ask your midwife, your healthcare provider, or a lactation consultant for advice. So from 36 to 37 weeks, you can start hand expressing your colostrum. And just it's worth remembering as well that it's never too late to start. So what you need to do is just make sure that you've got the time and the space just to allow yourself to relax and just concentrate on yourself for maybe half an hour at a time. So once you've got that time and space, you just need to make sure that you've got all the equipment that you need to hand. So you don't need very much. Okay, so something like a sterilised or very clean spoon that you can use to collect your colostrum with. Or any food safe, clean container. So you might be like a shot glass or an egg cup or something like that is absolutely fine. You might have some syringes, and you can get these from your midwife or the chemist or Amazon, just that you will need to store your colostrum in if you haven't got like a little food safe container. So you might have some like this without the cap that will go in the container for storage, or you might have one like this with a little cap, which is quite handy. Just make sure that the cap is kept away from small children and it's taken off before you give it to your baby. So you've got your equipment, you've got your time and your space, so just make sure that you've got clean hands. Go and give them a wash with some soap and warm water, and get ready to relax. So when you're ready, we're just going to start by massaging our breast. Okay, just really gentle strokes down towards the nipple. Okay, you might want to make circular movements. You might want to use your fist but just really gently. We don't want to drag the skin or cause any pain or damage. Okay, and then repeat on the other side. Okay, so we're just going to make those smooth strokes towards the nipple, perhaps using our fist, or circular motions like this. And warmth can help as well, so you can use warm flannels, or perhaps even for the first few times that you attempt to do it in the bath, and just see how you get on. Okay, so when you're ready, after you've massaged the breast for a couple of minutes, we're going to make a C shape with your hand, with your fingers, okay? And we're just going to walk back from the nipple until you find sort of a bit of a bumpy bit, okay? A couple of centimetres probably back from the areola, which is this dark area which the baby is eventually going to use as a target to latch on, okay? And we are going to push back against the chest just to put some pressure on the milk ducts, and push the fingers together, a bit like you're pressing a press stud. So we're pushing them together, holding the pressure for a couple of seconds, and then we're releasing. Okay, so press, compress, and then relax. Press, compress, and then relax. And it might take you a little while just to find sort of your sweet spot. It's different for all people. So just, play around just to see where you need to place your hands to be able to get some colostrum coming out. Okay, and when you've sort of done one area for a little bit, or when your hand expressing the milk sort of stops in that area, then we can just move our hand position to press, compress, relax. Press, compress, and then relax. Okay, and this is kind of, you're going to get into a rhythm, and this is a bit like when the baby breastfeeds. Okay, so they're going to be compressing and they're going to have that relaxation time as well. So you'll get into your rhythm, and just remember to change the hand positions. Maybe think of the breast as a clock face, so you can start with 10 and 6 and then move round to 9 and 3, 10 and 4. you get the idea. Okay, and when you've done that on one side for around 5 minutes, then change over and do the same on the other side. Okay, so you're gonna sort of walk back from the breast, making that C shape first, yeah, and then we're moving back from the breast, and we're gonna then press, compress, and then relax. Press, compress, and then relax. Okay, and then when you've done that for about 5 minutes, again changing your position around the breast, go back to the first breast that you were manipulating and have another go. And you might find that if you didn't get anything the first time, now that your oxytocin levels have raised a little bit, you might get a little bit more. Okay, so try for another 5 minutes, and then again on the other side for 5 minutes. So, all in all, looking at sort of 15 to 20 minutes, and you might start by doing that a couple of times a day and build that up to 4 or 5 times a day. Sometimes you might want to do more, some days you might want to do less, some days you might want to do it at all, and that's absolutely fine. It's really good just for you to get to know your breasts, learn the technique, and just feel ready for when you have your baby. So when you see the drops of colostrum appearing at the nipple, and you might find that it's appearing in different spots on the nipple too, then you're ready to start collecting those precious drops and making sure that you don't lose them. This is why we hand express rather than using a pump antenatally. We wouldn't use any pumps until you've had the baby, because you're not going to be producing huge amounts of colostrum, and the drops would just get lost in a machine, whereas you can collect every precious drop if you're using your syringe. So when you notice these little spots, you want to be collecting them onto your spoon. If you want to sort of collect them onto something first before, and then you can use your syringe to then draw that up, or you can just collect those drops directly from the nipple with your syringe, okay, and collect those. Colostrum is super concentrated, and it is designed to be produced in small quantities. A newborn baby's stomach is around the size of a cherry and can only hold 5 to 7 millilitres of colostrum anyway. So sort of looking about this size at the biggest, okay? And this here is 5 millilitres of colostrum. So it's really not a huge amount. So you're not going to be seeing a lot of colostrum. You may sort of have a mil, 2 mils, maybe just a few drops, but every drop is really precious, so collect it all. Okay, if you don't produce any colostrum for the first few tries or ever, don't be disheartened. It doesn't mean anything about your future abilities to produce milk. Some people don't produce any till the baby's born, but hopefully you will see a few drops, and it really doesn't matter how much you're producing. Also, it's really worth highlighting that you are not using up your colostrum supplies. Your body's amazing, and it's going to replace every drop. So the more colostrum that you produce, the more that your body is going to produce to replace that colostrum. So you really want to take great care of your colostrum now that you've collected it, and store it carefully. When you've got your colostrum stored in your syringes or in your food safe container, make sure that you label it with the date that it was collected and your name if you're planning on taking it into hospital. Put it in a resealable bag and then just store it into your normal household freezer. You can add to the same syringe or food container for up to 24 hours if you want to, or until it's full, whichever sooner, and then put it in the freezer, keeping it in the fridge in between collections. And you can add colostrum to the frozen collections as well, as long as it's not in a quantity that's going to thaw what's already there. So once you've got that all in the freezer, brilliant. That's all there, ready and waiting for your baby. When you go into hospital, you might want to take some syringes with you. So just pop them into a cool bag with some ice blocks and you can take those into hospital with you. Just make sure that they're labelled, people know that they're there and know where they're stored as well, just to make sure that they get used if they're needed. When you need to use the colostrum, okay, you can either thaw it gently in the fridge, or you can run it under warm water to thaw and then give to baby straight away. You would never thaw the colostrum in a microwave because of the hot spots. If your baby can latch on and feed directly from you, then you should do that. It's really important for your future milk production that the baby is suckling at the breast at the earliest stage as possible. Just keep your syringes in the freezer and just use them if you need to. Just remember that your colostrum is amazing. It is so precious, it's liquid gold. And having those syringes of colostrum available to you could prevent any other supplementation being needed during those early weeks when the baby is adjusting to life outside of the womb. If you're looking for any more information about hand expressing during pregnancy or anything else infant feeding related, I would really recommend the Association of Breastfeeding Mothers. So there's some leaflets available there about expressing your milk during pregnancy. La Leche League, there's some really nice information sheets available about antenatal expression of colostrum. And there is a website called firstdroplets.com, and that's really helpful as well. That's got some nice videos and information as well, just about, getting you ready for breastfeeding, infant feeding, however you go on to feed your baby. Thanks for listening.